Good evening, everyone. Right from Evrox Healthcare, we are back again with the part two of Let Us Brainstorm, as promised to you on the last Saturday when we did part one. Again, we are doing it with Dr. Dhruv Batra and continuing with him, being a consultant neurologist and also a specialist in movement disorders. Please welcome Dr. Dhruv Batra.
Hi. Thank you so much. Yeah,
Yeah, good evening, Dr. Dhruv, and let us begin with the part two, the neurological topics that we had left behind in the part one.
sure.
So, a lot of people suffer from Parkinson's, as we know. So, what would you say? What is Parkinson's, and how would you describe it? What is the symptomatology?
Yeah, I would begin by saying that we have a lot of topics to cover, but this is an important one, so I will spend some time here. And when you say a lot of people suffer from Parkinson's, one of the major reasons for is that a lot of people are in denial about their Parkinson's disease. I mean, if you tell somebody that you have Parkinson's disease, the first thing they'll look back at you is like, it's as if, it's just impossible. I mean, how come? And then they start to rationalize that it may be age related and all these things. So what I want to give the message to the audience here is that if somebody tells you that you've got Parkinson's disease, don't deny it. I mean, try to accept it based on the basis of the evidence and take the best possible treatment that is there for it. So remember, Parkinson's, we see it as a common man. A common man sees it when a person slows down, or when there is tremors in the hands, or you have difficulty in walking, or you are bent over, stooped, walking very slowly with baby steps. You may have difficulty in getting up. You may need support of a couple of people to just do your daily activities. पहले जो काम आप 1 घंटे में 15 मिनट में करते थे, अभी आपको आधा घंटा लग रहा है ना? Shaking हो रहा है, you tend to lose your balance. So this is when the common man sees it. But many years before you develop Parkinson's, you have some subtle signs that you may eventually have Parkinson's. For example, I'm not saying that everybody with constipation has Parkinson's, but people with Parkinson's do have constipation. So people who've had constipation for many years, sometimes they may have a loss of smell, which we call as anosmia or hyposmia, which was, by the way, also seen after COVID. That is a different issue altogether. You may have loss of smell because of a lot of local nose problems, but if without any reason, if you have a gradually progressive loss of smell, you have constipation, you tend to have bad dreams at night in which you fall off the bed, or you may injure your partner in the sleep in your dreams. These type of symptoms, you need to keep a watch that in the future such patients may develop Parkinson's. Not all of them do, but keep a watch. And you may have very common symptoms like drooling of saliva. So lots of saliva keeps on dribbling. Their pillow gets wet because of the saliva from their mouth when they get up in the morning. You may have urinary disturbances. You may have loss of bladder control. You may have depression, anxiety, fatigue, stiffness. Many of the patients of Parkinson's disease don't go to a neurologist first. They actually go to an orthopedician because they have severe joint pain, arthritis. So they attribute it to that. So what I'm saying is that Parkinson's can present with many faces. And if you have any of these symptoms, it is better to consult a neurologist and get it clarified, because we have very good medicines these days, and people do very well. They are able to do all their normal activities. I mean, there are a lot of people who've had the great Muhammad Ali. I mean, if you go back and if you're interested in what Parkinson's look like, you can go to the opening ceremony of the Atlanta Olympics at 1996, when he was given the the torch bearer who put you light the Olympic flame, and you will see what exactly Parkinson's looks like when you see Muhammad Ali in that video. And he had it because he was boxing for so many years, and because of repeated head injury because of the boxing, he developed Parkinson's disease. So Parkinson's can happen because of variety of reasons, like a stroke. After a stroke, they may develop Parkinson's. It can be because of head injury, it can be because of brain infection, it can sometimes be also a manifestation of somebody who has a brain tumor. In India, we have sometimes people who are taking migraine medicines. We discussed migraine the other day, and people who self-medicate themselves on migraine medicines for a very long time with some medicines, they can have Parkinson's because of the medicine, which goes away completely when you stop those medicines. You can have migraine because of, you can have Parkinson's like features because of lots of psychiatric medicines if you take them for a very long time without proper supervision.
Yeah.
You may have lots of things. I mean, most common things are antacids. So I tell people you have to be very careful. I mean, with all these drugs, because drug-induced Parkinson's is a big problem. So it's a lot of things, lots of detailed things are needed to be covered. But this is just to give an idea that what Parkinson's is and what it looks like.
Okay. So Parkinson's people do also suffer from dementia a lot of times, right?
Absolutely. And see, the thing is that usually patients with Parkinson's will have Parkinson's like features for a long time, and in advanced stages they develop dementia. But there are some types of dementia which start off with a dementia and they later develop Parkinson's. So that's something little different, but both can coexist together.
Okay. So now that we discussed about this, are there other types of dementias that you would like to discuss? Apart from, like, last time we discussed Alzheimer's, now we discussed Parkinson's, and there must be others as well.
Yeah. So let us see what happens is we always think of dementia as something that will happen to somebody else, never to us or our family. You all know the great Robin Williams, right? I mean, this fellow had a dementia called as dementia with Lewy body, which we called as DLB. And the problem with this dementia is they have hallucinations. They have visual hallucinations, which means they are in normally in psychiatry. I'm sure Surbhi knows that you have psychiatric patients who have auditory hallucinations, that they can hear voices which aren't there. But in dementia with Lewy bodies, you have visual hallucinations wherein you can see people who are not there. Your life is hell, not only for the patient but for his family. And this is what is known as dementia with Lewy bodies. And I will recommend all of you to read an article. You can Google it. Robin Williams committed suicide because of this dementia. Because he was so depressed with these hallucinations. The great Robin Williams, जिसने आप लोग को इतना हंसाया, इतना fantastic cinema बताया, इतना बड़ा, he was like a fun guy. I mean, and he ended up committing suicide because of this dementia. And his wife later wrote a beautiful article in one of the good neurology journals, and the article was titled "The Terrorist Inside My Husband's Brain." So it's a fascinating read. If anybody is interested about dementia, you should read about that. It's easily available on Google. This is one type. Then there are some other types of Alzheimer's is the most common type of dementia wherein you keep forgetting, and that's how it starts. And then you start to lose your direction sense. I mean, it's very easy for us to assume that if I catch an auto on the road, I will tell him कि भैया मुझे यहाँ से ले जाना, वहाँ से right turn लेना, यहाँ से घर पहुँचा देना, because you have a direction sense. You know where to take a left and where to take a right. People with dementia don't. So they just wander out of the house, and they are brought after 1 or 2 days by some lay person. If fortunately they have some ID on them. They was found wandering. You must have heard about people who get lost. घर से गए थे वापस ही नहीं आए. I mean, this can happen. They can just go and board a train. You don't know where they end up. So that is one more thing in dementia. Other than that, then they, as I told you last time, they have difficulty in doing sequential activities like wearing clothes, how to cook, and all these things. So that is a small brief about dementia. But remember, dementia always has treatable causes. You should not miss a single treatable cause. Anybody who has dementia, which means forgetfulness, loss of direction sense, inability to plan their activities, calculation. People are sitting in their shop, and let's say you are in a shop and somebody has purchased about 100 rupees worth of goods, and he gives you 500 rupees, and you have to return 400 to him, but you return the 500. So that can lead to severe economic losses for the family. They don't know how to calculate. They forget where they have kept money. They forget where they have kept the keys. So these are all the usual starting symptoms of dementia, and it usually starts off with forgetting names. But it's not so simple, because if that were the case, all of us would be having dementia if you say about forgetting names. But it is in spite of repeated reminders, you cannot remember. So then that is one of the signs of dementia. So don't miss dementia. If anybody has these symptoms in your home, in your family, especially somebody who is elderly, who's having diabetes, hypertension, who is on too many medications for various problems, must consult a neurologist.
Right. So I hope the advice was very, very clear to everyone that when you have dementia, please approach a neurologist. And especially, there are certain treatable causes which we had discussed last time also. So then the treatable causes can almost, make your dementia go away. So please do that. Okay. So we talked about migraine, specifically migraine in the last episode. But then there are a lot of other types of headaches people have. So let's talk about them now.
Okay. See, uh, always remember that there is something which all of us in neurology are worried about, and that is something which is a dangerous headache. See,
Yeah.
headache सबको होता है ना? There is nobody I think on this planet. I mean, we joke about it amongst colleagues कि जिसके पास भी सर है उसको सर दर्द होगा ही. But uh, there are some dangerous headaches that nobody should miss. And the most important thing is, if it is a sudden, as I told you last time, if it is a sudden headache arising out of the blue, and it is the worst headache of your life, if you feel that way, or if it is associated, it is not going away even after 1 or 2 days, you should consult a neurologist and do whatever he tells you to. There are some types of, for example, let me tell you, if somebody has gone to the loo, and if he is more than 50 years of age and he comes out of the loo with a severe headache, I would like to first do his MRI, because when you go to the loo, you strain sometimes, especially somebody who has constipation, and he comes out with a severe headache, which means that pressure has caused some problem in the brain. Sometimes it can be a ruptured artery in the brain. You may have some malformation for so many years which was undetected, but after straining, let's say somebody goes to the gym, he was absolutely normal before the gym, he lifted something heavy, and now he has come back with a severe headache. So this unusual sudden onset severe headache should never be neglected. If somebody has become suddenly unconscious after a headache, it should be never neglected. If somebody is having continuous vomiting or he's behaving abnormally after a headache, it should never be neglected. If someone has a headache which is associated with some other signs like fever, or very common in India, especially in children, बहुत बार they have discharge from the ears because the eardrum is ruptured and the infection goes in and it can reach into the brain. So don't miss it. If you have a headache with some rashes on the face, most of the times in local language we call it nagin or herpes or zoster, बहुत बार chicken pox के साथ भी होता है. So if there is a headache with these sort of signs, don't neglect it. And most important thing, if you are above the age of 50 years and you have a new headache, आज तक कभी हेडेक नहीं था पर 50 इयर्स के बाद हेडेक चालू हो रहा है नया, उसको बिल्कुल निग्लेक्ट मत करिए, क्योंकि यूजुअली माइग्रेन ऐसा नहीं होता है. माइग्रेन या तो बचपन से रहेगा या टीनेज ईयर्स से रहेगा, 50 साल के बाद नहीं आएगा. इट इज समथिंग एल्स, इट हैज टू बी लुक्ड इनटू, यू कैन नॉट निग्लेक्ट इट. Apart from this, there are some types of rare headaches. Like for example, there is something known as a exertional headache. You do some heavy work, there is a headache. There is a headache which happens only after you go to sleep. So for example, a patient sleeps at 10 o'clock, he gets up at 12 a.m. and says मेरे को headache हो रहा है. This is called hypnic headache. Why it is important to identify this is, it treatment is very simple. The treatment is 1 cup of coffee, nothing else. So you have to, I know it's difficult, but you have to sleep after taking a cup of coffee. You have to try. There is another type of headache which may be related to sexual activity. So sometimes people, when they have intercourse, they may have a severe headache after that, but then it has to be checked whether it is something else. So like this, there are lots of different headaches, but I think I gave you the gist that not all headaches are the same, and every headache has a different treatment. Some headaches need regular treatment, some headaches need an urgent MRI, some headaches may even need an admission, and it needs a regular follow-up with a doctor.
Yeah, there are some people who also have headaches going on for days together. Like कुछ लोग बताते हैं कि dull aching headache हो रहा है लेकिन 4-5 दिन से लगातार हो रहा है. कुछ लोग ये भी बोलते हैं कि सुबह उठ के headache start हुआ. Like I woke up with a headache. So what
Right.
would your advice be for them?
One thing I think you brought up an important point is somebody who has a early morning headache, and it is always early in the morning once he gets up, it can sometimes be a sign of raised brain pressure. So most of the time when we see these patients, sometimes there is a condition called brain hypertension. What does that mean? Brain hypertension means that the pressure inside the brain has increased because of some reason. And this type of headache will increase more in the morning. It is not there so much throughout the day. So such patients should remember to get evaluated for this. Another very common cause is something I think all of us know about Bappi Lahiri, and you remember that he passed away recently, and the diagnosis was given as obstructive sleep apnea. And I think, I know we shouldn't be discussing people here, but because it is public information. I mean, this was released to the media and the public by the family, that obstructive. You know Bappi Lahiri, right? He's little obese, and uh, he had obstructive sleep apnea. What happens is in the night when they sleep, they can't breathe easily. They need a machine to breathe, which is known as a sort of a semi ventilator at home. It's like a CPAP machine. It's a home ventilator. You can easily apply it. And people who have this, before it is diagnosed, they come to the hospital with the early morning headache, because at night they've not been able to sleep because of the inability to breathe easily, and because of the low oxygen status in the brain, they have a early morning headache. So somebody who gets up in the morning never feels fresh, नींद अच्छे से नहीं हो रही है, he's obese, maybe has a history of taking lots of alcohol, and has a lot of early morning headache, this should also be considered.
Okay. Thank you for giving examples as well, because I think it attracts the public more to understand the information better.
Exactly. Exactly.
Okay. Yeah. And now that you are a movement disorder specialist, so हमको काफी बार पेरेंट्स आते हैं ऐसे कंप्लेंट्स लेकर, कि बच्चे को झटके आते हैं, बच्चे का मुंह काफी बार फ्लिकर होता है, टेढ़ा होने लगता है, या आंख के आसपास होने लगता है कुछ कुछ, या they have rapid movements around their body. So what are those? What are tics? And what would you like to say about the tics and the advice to the parents as well?
Correct. So this is a very common problem, because बच्चों में कभी भी when there is sort of a problem, parents tend to get panic. I mean, they panic what is happening, and then most of the times kids are playing with each other and they will notice and this. See, what happens is tic. मतलब many a times you must have seen that children have this habit of shrugging their shoulders without any reason, or they may have this some movement which doesn't seem anything purposeful. It's like this. I mean, they keep doing like
Yeah.
this. Sometimes they may just keep blinking their eyes for no various reasons. Sometimes it can be severe, which may be they may be producing voice without any reason, like like that, or they may be coughing without any reason, like.
Yeah.
So they feel they keep doing this, and everybody is worried why this is happening. So this is what is known as tics. And see, what happens is, when are we worried? When it is happening suddenly. कल तक नहीं था, अचानक एक दिन में पूरा हो गया. So sometimes this can be a sign of a infection, which we called as a streptococcal infection. So it's a common infection, and after that children tend to have this. So it needs to be identified, because you have to treat the infection to treat the child, and it should not worsen. Secondary, uh, these type of tics sometimes can be seen as a part of a bigger syndrome known as Tourette syndrome. So uh, we know what is Tourette syndrome as medical professionals, but for the general public, there's something known as, there is something called OCD, obsessive compulsive disorder, wherein you tend to keep washing your hands for hours together. If somebody touches you, you feel violated, and you take a bath. You are very sensitive about hygiene. You keep sweeping the floor 10 times. So that is a OCD behavior. That, along with tics, is seen, and along with something known as ADHD, that is a attention deficit hyperactivity disorder, which is more in the realm of what Survi treats. So when these things are seen together, we call it Tourette syndrome. So again, this is not something infective, but this is a part of the child's disease. But we don't call it a disease, because most of the time it starts at the age of 10 years and it goes away by 18 on its own. You don't need to worry. So that's something positive there, but it needs to be identified. Whether it is tics, whether it is something else, whether it needs treatment, whether it will go away on its own. the reassurance part, what important tests have to be done. So all this. So you should not forget that.
Okay, so are tics treatable, and what would the advice to the parents be?
Absolutely, they are treatable. Everybody has a different severity of a tic. You need to, there is no surgery involved. All you need to do is take medications. Lots of good medications are available. And you just don't, I would like to reassure everybody that just consult a specialist. Don't worry too much. Most of the time it goes away on its own. Just take good treatment. Yeah.
Okay. Uh, because we finished the Parkinson's lot, I think we should first answer the question that is it reversible? Is Parkinson's disease reversible?
uh, Saying Parkinson's reversible or not would be like saying is aging reversible. No, because Parkinson's itself is it's sort of a degenerative process. But yes, I would like to put it in a better way. Can you reduce the can you reduce the speed with which Parkinson's will progress? Yes. So if you take your medicines regularly, your symptoms will be under control. If you take good amounts of vitamin D or you are exposed to good amounts of sunlight, your Parkinson's ka progression ka speed will reduce. And if you are active physically, like you do at least 45 minutes of physical activity every day, including physiotherapy, then your speed of Parkinson's progression will come down. So this is what is proven. These three things are important: good nutrition, and as with any other disease or any other condition, if you have a good nutrition, lots of vegetables, fruits, multivitamins naturally, physical activity, vitamin D, uh, good hydration, avoidance of addiction, smoking, alcohol, and other substances, I think you can reduce the speed with which your Parkinson's will progress.
I think now that you talked about not having alcohol, I just remembered a joke which was there. Ki a question was asked ki which dementia would you prefer, Alzheimer's wala ki Parkinson's wala? Okay, I mean not dementia. Which disease would you prefer? So the person answered ki I would rather spill half of my alcohol with Parkinson's rather than forgetting where I put my alcohol glass.
Yes, yes, that's a good one. So Parkinson's is
Uh,
better than Alzheimer's. You would rather spill your drink rather than forget where you kept it.
yeah. Okay. Okay. So neuropathies. I think neuropathies is a very very common thing, and we should discuss about that. So, what is peripheral neuropathy, or what are the other types of neuropathies, and what are the symptoms?
That's a good question. That's a big problem. That is something which affects patients a lot. See, neuropathy is simple thing is that your nerves are swollen or they're injured basically. Now the question is, why are they injured? The most common cause that you will get in India and across the world is diabetes. So all patients with diabetes who are unfortunately not able to control their sugars, or even sometimes they manage to control their sugar but the disease has been there for a very long time, they tend to have diabetic neuropathy. And what is neuropathy? Basically neuropathy means you have this pins and needles sort of sensation in your legs. मतलब in Hindi we call it पैरों में चींटी जैसा लगना या जलन होना, आग होना, ऐसा लग रहा है कि कोई पैर में सिगरेट चुभा रहा है, जलता हुआ सिगरेट चुभा रहा है. And then in Marathi we call it हातापायाला मुंग्या येणं. And so this is all sometimes there can be numbness, matlab you lose the sensation over the feet. The problem is if you get injured or if you are hit, you have some injury, you don't sense it, and then that wound can keep on progressing. So this is the typical symptoms of neuropathy. uh, Sometimes neuropathy, usually it will start from the legs. First it will involve your feet. It can start in one foot, go on to the other, then it progresses upwards. By the time it comes to the knees, your hands also start to get involved. So that is how it progresses. Very rarely you can have neuropathy in very limited areas of the body. Like for example, uh, in India, the leprosy is still a very common condition in spite of so much being done by the government. So it is basically because of an infection which we call as leprosy infection, and it damages the nerves. So you may have numbness in one part of the hand, you may have numbness over a part of the face, you can have numbness anywhere in the body where nerves are present, along with skin changes. So that is something else which is very common in India. Other common causes are alcohol. Again, we come to alcohol because it can cause a severe type of neuropathy. Other problems are nutritional neuropathy. People who are deficient in certain vitamins like B12, B1, that is thiamine. Again, in alcoholics, you have low vitamin B1, and then you tend to develop neuropathy. People with kidney disease, people who have who are on dialysis for a long time, whose renal kidneys are injured because of diabetes or various other problems, they can have neuropathy. So causes are many, and there are sometimes different types of inflammatory conditions which we call like arthritis, various types of arthritis like rheumatoid arthritis and different types of arthritis which can result in neuropathy. So neuropathy can be because of many things. You need to find the cause why there is a neuropathy and treat it, because if you don't treat it, it is going to become irreversible, and it can cause a lot of problems, and eventually it can result in disability. You cannot move because of the weakness. So again, consult your doctor. They may give you medicines to soothe your symptoms, relax, so that you don't have the pain and tingling and burning. But at the same time, they would also start checking out why you are having this neuropathy. Sometimes, remember, neuropathy can be genetic. Lots of family members having it, especially when families are in consanguineous marriage, like married within the family or in close relations. So that has to be kept into account, because sometimes what happens is they are very sensitive to certain drugs. I mean, we have this a particular type of neuropathy wherein you cannot give a common medicine. We know ciprofloxacin is a very common medicine that we give to anybody who has loose motions or fever, but you cannot give it to them because it will damage their nerves permanently. So all these things are interrelated. So you need to be very careful about what is the neuropathy, why is it there, how we can best treat the patient and potentially cure him completely.
Okay, so can vitamins help in neuropathies?
Absolutely, absolutely. But the point is which vitamins and in what dose. Because the problem is sometimes if you give too much of, sometimes there are patients who just feel that vitamins are to be taken lifelong. And you sometimes don't realize that there are some vitamins which don't get washed out of the body on their own. They tend to accumulate in the body and cause toxicity. So then you can have, sometimes if you take it for a long time, the vitamin itself can create a neuropathy. So uh, it has to be all done under a guidance of an expert or somebody, your doctor.
Okay. Another common thing that people discuss after dementia is delirium. So you must have seen a lot of delirious cases coming to you. So would you like to, let's go into the description
Yeah.
of what is delirium?
See, delirium is basically, there are two types of delirium. One is hyperactive delirium and one is hypoactive, which means usually we see hyperactive delirium. And in delirium, what happens is patient becomes very aggressive, extremely agitated, violent, uh, completely abusive, completely out of control. And this is very commonly seen in people who have already have dementia, or some elderly person who is already little aging and his brain is not that strong. When they are admitted to the hospital, they tend to become delirious without any reason, because there is a change in environment, there is change in their surroundings.
Yeah.
In the hospital there is no sense of day and night, so that is the problem. Then uh,
Yeah,
sometimes
generally
very
we see that in ICU patients.
Absolutely. So that is what is also known as ICU psychosis. I mean, nowadays it's
Yeah.
replaced by delirium, but still people remember that thing, ICU psychosis. As soon as you admit somebody, elderly patient in the hospital, he tends to become go into psychosis. So that is delirium for you. And uh, you have to see, delirium basically, anybody who has a patient with dementia at home, or you have some elderly family member like a grandparent who is at home and bedridden and he's maybe having dementia. You must have faced this situation ki in between there are times when they become violent, they become aggressive, and it's little really disturbing for the family to realize what is going on. And it's really hard time because somebody, your family members, is in so much of agony, and he's not able to sleep. The entire family is also affected indirectly. So what I would like to tell you is that in delirium, we should always look for, again, easily treatable causes. I will give you an example. One of the commonest causes of delirium is not something hi-fi which is written in some corner of some big book. The commonest cause of delirium in an elderly can be constipation. He has not passed motions for last 2 to 3 days, and now he is in discomfort. And unfortunately, because of dementia, he's unable to speak out or exactly tell you what is going on. And you just treat the constipation with some laxative, कुछ medicine देके motions pass हो जाए, he becomes absolutely fine. Another simple cause I will tell you is if their diaper is too wet, so they feel uncomfortable. I mean, anybody would. The diaper has not been changed by the treating caregivers, and it has now become wet and soggy. That is irritating him. So that is another cause of delirium. It can be something very simple as some pain somewhere, some injury. It can be hunger. You've forgotten to feed him on time, and even if you delay by 1 hour, I mean, if your usual lunch time for us is at 1 p.m., if somebody tells you or keeps you waiting till 2 p.m., you would also become irritated. So hunger, low sugar, hypoglycemia, constipation, very common. Urine infection. Most of these patients with dementia are catheterized, which means they have a pipe inside their urinary tract, and that is where the infection starts to spread, and that causes infection and delirium. So I'm just giving some examples that it can be very easily managed if you look for these causes and teach the family that all this is easily possible at home. Sometimes I can understand it is difficult to treat this at home, but most of it can be done.
Another very common cause of delirium that we psychiatrists come across is alcohol withdrawal delirium or any substance withdrawal delirium. So in that case, the patient is brought to the IPD or the emergency psychiatry department, and that is where we start with the treatment. So during that time, I'm just wanting to tell the public that it may start any time from the third day of withdrawal to 1 week of withdrawal. So kindly, pay attention. So say for example, somebody who is constantly consuming a substance or has substance use disorder, alcohol use disorder, which is a very regular consumption of alcohol. So in that case, if suddenly it is withdrawn, especially with people who consume country liquor, जैसे हम कहते हैं, देसी दारू, उनके साथ ये ज़्यादा होता है because it is unfiltered. It is not that filtrated, and it has more amount of methanol as compared to ethanol, which we find in the foreign liquors or the English liquors. So उनमें सबसे commonly होता है और 72 hours से लेकर एक हफ्ते के बीच में कभी भी हो सकता है. So pay close attention to that. Okay. So another thing that happens, we have come across even during our MBBS days is myasthenia gravis. Certain people have that. So what would you want to talk about myasthenia gravis, the symptomatology and the treatment?
I mean, another example, your KBC, the great KBC host, has myasthenia gravis. So, I mean, it's something so Mr. Bachchan is doing a fantastic job in spite of being having myasthenia. So, it's nothing. Myasthenia gravis is something wherein what happens is that.
In fact, because of the myasthenia gravis, he could give that really rigid expression during the movie Pink. जिसको एक्चुअली बाइपोलर ट्रीटमेंट दिखा रहे थे, वो ये दिखा रहे थे कि he was in EPS, मतलब, but basically it was his gravis acting up, and that is the reason he could give that expression.
Fantastic! I didn't know that. So much of neurology in our lives and in so much of public individuals, right? So see, I mean, the point is that myasthenia gravis is something, basically it's sort of a, I would like to put it this way: don't treat it as a disease. Basically, your muscle strength for the day is limited. Let's put it that way. And let's say you have, as a normal human being, let's say I have infinite amount of muscle strength, in the sense that I can go on speaking, but my voice won't go away throughout the day until I stop. But with somebody who is myasthenic, if he speaks for more than, let's say, 2 to 4 hours, his voice will start becoming weak, because the energy supply, or the chemical known as acetylcholine in his blood, either it is deficient, or there is some antibody which is blocking it. So to put it in a brief, this thing, that basically the chemicals that are needed to make your muscles work, to make your eyes open and close, to move your eyes, the chemicals that are needed to produce voice, the chemicals that are needed to swallow, they are in short supply. And as a result of that, you tend to have all these symptoms. Somebody can have what we call as drooping eyelids, so they come to you like this. So one eye is open, one eye is drooping. They may have a very weak voice, and the unique thing is that they are absolutely normal in the morning, and as the day progresses and they go till the evening, their supply gets depleted, and hence they have lots of these symptoms in the evening. So that is how we identify myasthenia. And again, it is a very easily, I mean, I tell patients that from neurological diseases, if I want to choose any particular major disease, I mean, leave out these migraines and all headaches, but if I were to choose a disease, I would like to choose myasthenia for myself, because it is so easily treatable, and all you need to do is take some medicines and you will be fine. But remember, uh, myasthenia, you have to find out, again, as I told you, as in all diseases with neurological problems, you have to find out the cause. Why? So there is a why in every disease, and even the myasthenia is no exception. So sometimes you may find a cause, so you can permanently treat it. Some people tend to have a small tumor behind their chest bone, which is known as a thymoma, and that is the reason they are having myasthenia. So you remove the thymoma, most of them are back to normal. They don't need to take medicines for lifelong. So that's two words of wisdom for myasthenia gravis.
Okay. Okay. So I think the next topic that we should move on is ALS. And one of the very famous personalities that had ALS was Stephen Hawking, who recently passed away. So, what would you say about ALS? What are the symptoms and how does it progress? And is there any treatment?
You brought up Stephen Hawking. Let me just share some interesting information about him. Stephen Hawking had ALS, but till date, nobody can give an explanation why he survived for so long. And there is I mean, it's not a joke, it's a fact that the doctors who diagnosed ALS in Stephen Hawking, and told him that he had no more than a year to live, he outlived all of them. All of his doctors were dead, but he was still alive, because he
Oh,
was given a
wow.
diagnosis. Yeah, he was given a diagnosis way back in about 50, 60 years back, somewhere around that time. So he has outlived all his doctors when they gave him not more than 6 months to a year to live. So see, the point is, our audience doesn't know what is ALS, but I think that ALS challenge, that ice bucket challenge, was
Ice
very
bucket challenge.
popular.
Yeah.
Yeah, it was very popular, and a lot of people came to know about ALS. So ALS is basically amyotrophic lateral sclerosis, but it doesn't matter what we call it. The point is, what happens is that your cells in the body, which are responsible for generating the electrical activity to produce movement or muscle activity, they are getting damaged, to be honest. And what happens is, it's happening everywhere. It may happen in the throat. So you know that Stephen Hawking, he couldn't speak, so he used to use a that device wherein his sort of commands could be converted into voice, or he had a device like that. So you cannot swallow. You have difficulty in swallowing. This is different from myasthenia, because myasthenia will improve with medicine. This will not. We still don't have a cure for ALS, and basically it's not a very good disease to have, honestly speaking. You may have wasting, and you may lose the muscle mass. Your hands become thin, your body starts to shrink, your muscles start to waste, your respiratory muscles also start to get involved. So it's like basically like a slow death, and it's a pretty painful one at that to observe, from a doctor's perspective, from a relative or a patient's family member's perspective. And unfortunately, we still don't have any treatment. Lots of research is going on. There are some types of ALS, or I would not use the word ALS, but motor neuron disease. There are some rare types, very few, less than 10 or 5 to 10%, wherein again, as I come to the point, what is the cause? Sometimes people with some other disease may have this ALS or motor neuron disease, and hence potentially it can be treatable. Let's say somebody has an HIV infection, and people with HIV sometimes have a motor neuron disease. So it is postulated that if you treat the HIV because it is the cause, you may improve motor neuron disease. There are very few cases which look like ALS or MND, but they improve because you have found the cause. So there are sometimes some malignancies like some cancers which may present like ALS. So what I would say is, again, it comes to the same point: consult a doctor, trust him, do whatever is necessary. And unfortunately, sometimes we may not get a cause, and in which it is more like a sort of a palliative care. You need to just do supportive care, nursing care, and manage these patients. You can solve their problems of swallowing by putting in a tube through the stomach. They may have some devices which can aid in speaking. Physiotherapy, good nursing care, good nutrition can help them live peacefully till the end of their illness or their life. Yeah, but not a very good disease to have.
Yeah, so basically there is no treatment as of now, but yeah, palliative care is available. Next, I think we should talk about cerebral palsies. So I think a lot of parents must be coming to you with children having cerebral palsies. So I would also like to ask that can cerebral palsy be diagnosed when the baby or when the fetus is in the uterus? If so, would you as a neurologist, you know, say that they should be aborted? And if after birth, how should the parents handle children with cerebral palsies? So three questions in one.
Yeah, no, see, what happens with cerebral palsy is, see, by the time the child is born, you still don't have a idea about how his intellectual capacity is, unless he's born, and then how he will start to achieve his milestones. See, I will start from within the womb. When the child is within the womb, nowadays, the best possible, what we know as the anomaly scans, these are being done to find out whether whether a child is having malformations or not, whether his brain is growing properly or not, and other body parts are growing properly or not. Unfortunately, that's the best you can do structurally, which means whether the body parts are formed properly. That is can be done within the womb. And sometimes things which can damage the baby's brain, like infections, they are tested regularly. There are some blood markers which tell us whether this child will develop intellectual disability. We don't call it cerebral palsy, but like for example Down syndrome, various other syndromes, which basically manifest like the same. Like it will result in a poor intellectual development of the child, or what we know as a global developmental delay. So this can be checked intrauterine, that is within the womb. Once, what usually happens, the most common cause of cerebral palsy is what happens during birth. That means if the child is being delivered at places which don't have good facilities, sometimes before delivery, before the birth, the obstetrician tells us that this baby is in a sort of a wrong position. Matlab, his head is not going to come out first, the legs are going to come out first. In such cases, they don't take a risk and they do a cesarean section. Sometimes if you are in a good setup, when they are normally delivering the baby, uh, the baby is not coming out sufficiently fast, so he's at a risk of developing low oxygen status and injury to the brain. In such cases, the baby may be taken for an emergency cesarean section. All these can be done, but in places, especially in rural India, where healthcare is not that developed, and still many deliveries are being done at home or by some locally trained dai. Now that has come down because of good government initiatives, but still. So what happens is the baby gets asphyxiated or suffocated during birth and has a permanent damage to the brain. And that is how he develops cerebral palsy. The effect may not be seen immediately. Sometimes the baby just does not cry after birth. So that is when you know that this baby has a chance of developing cerebral palsy. And then gradually, when they have they don't achieve their milestones on time. Sometimes they may develop jaundice. All babies may, most of the babies may develop jaundice, but that is a physiological jaundice. But sometimes there is a pathological jaundice which develops immediately after birth. So in that cases, the the jaundice damages the brain, and then these children can have sort of a cerebral palsy. But it is very difficult to predict within the womb who will develop cerebral palsy or not, because of the reasons I told you. Because of behavior of the baby, his actions can be judged only after he's born. But yes, if within the womb you get the proof of some disease, based on the scans or on the blood reports, then yes, the families can be counseled. Actually, that is the purpose of these tests, that within legal limits, then the families can be counseled to go ahead with the medical termination of pregnancy.
Okay.
Uh, Sorry, I think I just, there was some voice thing. Can you repeat the question?
Yeah, I was saying, how what would your their babies with cerebral palsy or their children with cerebral palsy?
Again, I think there's some voice disconnection. Can you? I'm unable to hear you. Yeah,
Are you able to hear me now?
yeah, I can hear you now. Yeah,
Okay. I was saying, what would your advice be to parents who have children with cerebral palsy?
yeah. See,
How should they
one
manage this?
important, yeah, one important thing is that, see, many a times, not all intellectual disabilities in children are cerebral palsies. Most of the times, when the child refuses to achieve, when the child doesn't achieve his milestones on time, we just people blindly label the child as cerebral palsy, and there is no particular treatment for cerebral palsy. So, again, I will repeat, you have to be very sure whether the child has cerebral palsy or not. If you say the child has only cerebral palsy, then the treatment becomes more of palliative. Matlab, it is more about non-medical care, like they need to be in a special school, they need special needs to be taken care of. But there are sometimes some diseases which are potentially treatable, and it may not be cerebral palsy. Many a times the mother is telling the doctors that my child cried completely normally at birth, my child did not have any jaundice. So everything that you would associate with the cerebral palsy is not there. And hence that brings us to the question that the diagnosis of cerebral palsy is in doubt. And these children should be evaluated in detail, because they may have some inborn errors of metabolism which can be potentially treated with some sort of nutrition, some sort of therapy. So that is my advice to all the parents, that if you have a child with cerebral palsy, consult somebody who is trained in neurology and a specialist in pediatric neurology, and take their advice, so that you are very sure that you're not missing out on something that is treatable.
Okay. So the next topic that we have is multiple sclerosis. So how does a patient with multiple sclerosis present and then get diagnosed, and what is the management?
Multiple sclerosis, very common problem in the West. Uh, Also very common here, but not so common, because we have a large population, so we do have many patients. See, remember, multiple sclerosis is, just to give you an example, it is basically a damage in the wiring of our nervous system. So, electrical wire we have at home, it has a copper wire inside and it has insulation from the outside, right? So, in multiple sclerosis, what happens is that the insulation, the covering or the insulation of the wires of the brain and the spinal cord, or the nerves to the eyes or the face, they are sort of, let's say, burnt, because of the antibodies that your body is producing, or your body is yourself damaging your nerves. And It is usually very common in females, but also seen in males. It is usually seen between the age of 15 to 45. Usually, they may come just with sudden loss of vision in one eye. They may come with some abnormal tingling or numbness in one part of the face. They may suddenly come with weakness or one side of the body. They can come with lots of symptoms. They may suddenly come with difficulty in passing urine or passing motions. It all depends on which part of the brain has been injured. So, this is what is multiple sclerosis. Now, the question is, first of all, you have to be very sure whether this is multiple sclerosis or not. Second, treatment has to be started immediately, because sometimes if you don't treat, the damage can be irreversible. So let's say one eye is involved and the patient can lose vision in one eye if you don't treat in time. If one part of the body is involved, he can be bedridden for life if you don't treat or intervene in time. And the problem with multiple sclerosis is it doesn't happen once. It is a relapsing remitting disorder, which means it will have multiple attacks. That is the reason it is called multiple sclerosis. It will happen again and again unless you do something to prevent it. So the treatment involves preventive therapy. The treatment also involves an acute therapy, which means as soon as you have an attack, you are given some medicines to relieve your symptoms, and then you are started on preventive therapy to prevent the attacks from happening again and again. And it involves specialized care. It involves a trained neurologist who is experienced in multiple sclerosis. Lots of initially some investigations need to be done. MRIs have to be done, blood investigations. There's something known as a CSF. That means you check the brain water for test. You send it away for testing. But yes, there are a lot of good treatments available for multiple sclerosis, and people are doing very well. They are doing absolutely fine with multiple sclerosis with treatment.
Okay. So the last topic that I have on my list today is Huntington's chorea. So would you kindly describe how it presents and what are the genetics involved and is it treatable?
See, basically, before we speak about Huntington's, people should know what is chorea. And what is chorea is somebody who has these dancing like movements. So they continuously, they are very fidgety. So let's say if I have chorea, I would be always like moving like this, my hands will be moving like this, and they're always like in a state of dancing sort of a thing. These are random movements. Suddenly they will have like this. It may be sometimes mistaken for tics also. But the chorea problem, it has many causes, but most of the times there are some treatable causes. But every time it may not be. Well, you can control it, but you may not be able to treat it, cure it. Huntington's chorea. See, remember, Huntington's chorea means the chorea will be in families. So this movements, this dancing like movements, like they're always there. They're always like fidgety in their seat. This may be seen in families. So there will be a history that the father has it or the mother has it and the siblings have it. And then if you carefully ask for history, all this chorea, when it is seen in families, you suspect something known as Huntington's chorea. So why this is important is because you have to counsel these patients that if you marry and you have a child, he may also have chorea and Huntington's chorea. Now, unfortunately, Huntington's chorea, the chorea is only one part. It is not that troublesome. There are a lot of other problems. Patients with Huntington's chorea may have dementia. Sometimes they may have suicidal tendencies, and sometimes we get a history of Huntington's by asking whether your family members, whether your brother, whether your parents committed suicide. They have a very high suicidal tendency. And sometimes when you tell somebody that a disease is not curable and it is now going to go on in your family, generation across generation, it may cause depression also. And that may drive them to suicide. So, depression, chorea, anxiety, suicidal tendency in the family, dementia, then they tend to have lots of weight loss. All this can be signs of Huntington's chorea. And the most important thing is to identify it. Simple blood test is available which can confirm the disease or not, and treatment is available. Nowadays many centers take good comprehensive uh, treatment of patients with Huntington's chorea. and we can give a lot of good care as compared to earlier. Nowadays there are lots of support groups also, wherein people of Huntington's disease can form a group and share their experiences and share their treatment and how they can feel better, and they can guide each other regarding good treatment centers also. So that is Huntington's chorea for you. Again, not a very good disease to have, but if you have it, then you no option but to deal with it in a best possible way.
Okay. Thank you, Dr. Dhruv, for all of those answers. And we discussed so many topics of neurology today. And I think this video will be available on YouTube and Facebook permanently. You can definitely go back and watch in case you or any of your family member has any kind of disease. Also, we do have a question. How can we know, confirm if someone has alcoholic neuropathy?
So that's, I think, again, whenever you have neuropathy, we tend to look for the cause. And what happens is, usually, see, it's not like everybody who is going to consume alcohol is going to have alcoholic neuropathy, no. But then there are some markers, like for example, if you consume too much of alcohol, like you're consuming alcohol daily for many years, you have a high chance of having alcoholic neuropathy. I mean, if somebody comes to me with a neuropathy, I will ask him whether you have diabetes or not. So if he has diabetes, more likely to be diabetic neuropathy. But if he doesn't have diabetes, but he's taking alcohol for a very long time, and see, alcohol, if it goes into your system, is not going to cause only neuropathy. It will cause a lot of other problems as well. Like Surbhi told us about alcohol withdrawal or alcohol-related diseases. They may have liver swelling, which is known as cirrhosis. So they may have jaundice. They may have lots of other signs and symptoms which we can clinically identify whether that this person is consuming lots of alcohol. So this is how you confirm. There is no confirmatory test to prove alcoholic neuropathy. The history, whether the knowledge, the fact that you are taking lots of alcohol and now you have neuropathic symptoms is good enough to diagnose that you have alcoholic neuropathy.
Okay, yeah. So I hope that answers that. Okay, so I think we are okay. There is another question. What is the life expectancy in Parkinson's disease?
See, usually the life expectancy or the lifespan doesn't reduce in Parkinson's disease, because usually in the normal type of Parkinson's disease. But again, as I told you, Parkinson's disease can be of different types, and there is sometimes what we known as a typical Parkinson's, and there is something known as a atypical Parkinson's. So the atypical ones are the ones who have a reduced life expectancy because of the fact that they don't respond very well to treatment. And then what happens is they have difficulty in swallowing, and then all that saliva and food goes into the lungs, so they have pneumonia, they have infection, and that can reduce their lifespan. Sometimes they don't respond well to physiotherapy and treatment, and then they can have fall, and because of the fall then they have a fracture, or they can have a head injury, and that is what causes life threatening problems. So that is the thing, that Parkinson's itself will not cause a problem, but the complications that can happen because of the poor response to therapy is what can reduce the life expectancy in these patients.
Is pimavanserin
So I think,
available in India?
yeah, so pimavanserin is something that has been used for, as we discussed, psychosis. I mean, we were discussing about the dementia with Lewy bodies and the Robin Williams situation. So pimavanserin, I have not yet, it is not available with us here. Some people are getting it from the US, but I have not yet used. I have not, because we have drugs which are doing the job pretty well, which are available with us for a very long time. So I am not yet aware of its availability in India. Yeah.
Okay. So thank you, Dr. Dhruv. Would you like to give some, wrapping up comments or advice to the public?
First of all, it's a fantastic. It's been fantastic 2 Saturdays. It was fantastic to be here. We've had a lovely audience, lovely host, and people have been. I think they've been very attentive, because I can make out from the questions that they were asking. I think what I would like to say is that, see, neurology is a very diverse field. There are many times misconceptions among the population and even amongst doctors that neurological problems are not treatable. That is very wrong. If you find out the cause, You can treat almost everything unless there is no cure for a particular thing in the world anywhere. So I'm not saying that there are yet, but that is the case with any other field. I mean, let's say somebody, people have heart attacks. People have life-threatening conditions. People have liver failure because of alcohol. People have lung cancer. People can have lots of problems for which we still don't have a complete cure. So many times things are treatable and manageable with the proper care. All you have to do is consult the right person and get yourself evaluated properly. And with the advent, with the time that we are moving forward, lots and lots of new interesting findings are coming up in this field. Lots and lots of patients are doing very well because of newer drugs, cheaper drugs, and with the good overall holistic care that is available in neurological problems, including physiotherapy. Even for dementia, wherein people have been told that nothing is possible, with good treatment, with correct treatment, with treating reversible causes. And there are nowadays dementia exercises, like you have exercises for bodybuilding, you have exercises for brain and mind building. So people are doing very well with the correct treatment. So I would like all of you not to lose hope. Not to lose hope. If you have any neurological problem, consult your doctor. And I'll just take this opportunity to tell you about one thing. If you have somebody with Parkinson's disease in a very advanced stage, we have a new treatment. It's not a new treatment. It's been there for 10 to 15 years, but now it has been popularized and lots of people are getting benefit of that, which is something known as a deep brain stimulation, which is also known as brain pacemaker surgery. And remember, we put a lead inside the patient's brain and a battery is attached here, and it can work wonders in correct patients. I'll repeat the word, correct patients. So the patient selection is very important. It is not something that all Parkinson's patients can do this battery implantation and the disease will go away. No, it is not a cure, but it can make your life very, very comfortable. It can reduce your dosage of medicines by more than 50-60%, in some cases up to 90%. It can reduce the side effects of your medicines. People, especially who have shaking of the hands, which does not respond very well to medicines, they can have a dramatic, magical effect with this deep brain stimulation surgery. So I thought I will introduce you to this. You can Google it, you can read about it. It is known as DBS, deep brain stimulation. It is being done at many centers. I am trained in it. We, along with a neurosurgeon, are involved in doing this. And in the correct patients, it can give lots and lots of benefit, especially patients with Parkinson's disease. You read about it and then maybe we can answer your doubts about it at a later date. Thank you very much for having me.
Thank you, Dr. Dhruv, and you have been a wonderful, brief, precise, informative speaker since both the Saturdays, and it was wonderful having you. So thank you for accepting our invitation at Ebrox Healthcare. And Dr. Dhruv Batra is based in Nagpur. You can definitely contact him directly, or he also does teleconsultations, so you can contact him on that as well. Talking about teleconsultations, our F1 app is also coming up, in which we would definitely like to enroll Dr. Dhruv as well, and a lot of other doctors, nutritionists, healthcare workers can get enrolled. And we are definitely wanting more and more people. So do contact us on our website, on the telephone number that you will see on the poster, just as this ends. For this, also like, share, and subscribe our channel. You can also comment as to what you would like us to cover in the next upcoming sessions. And also, it's Pride Month, so happy Pride Month, everyone. I am very proud to be associated with Ebrox Healthcare, which not only supports Pride only during the Pride Month, but all throughout the year. So we have changed our logos on all the social media, that is Twitter, Facebook, YouTube, everywhere. You can see that. And thank you for joining us and being a wonderful audience as always. Have a good night.
Thank you. Bye.